Hi there, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health and our YouTube channel, Health and Horsepower. Now, I am here to talk today a little bit more about carpal tunnel, but also why a lot of people that claim they have carpal tunnel actually don't. So first thing I want to do is kind of go over a little bit more of the anatomy. But before I do that, I want to talk a little bit more about the fact that when it comes to hand, arm, wrist pain, there's a lot of different things that overlap that can get misdiagnosed. So when it comes down to it, you actually have the bones in your neck, you have a disc in between those and a nerve that exits out the side. That nerve goes all the way down your arm and supplies your fingers. Now, that nerve actually breaks up into a couple different spots at your elbow. So sometimes we can have neck issues that can contribute to issues in the hand and arm. We can sometimes have elbow issues that contribute to issues in the hand and arm. But the other thing too is you have blood flow, nerve flow, all going down this side of your neck. So if you have muscle tension or you have a shoulder injury, you may actually have muscles that are squeezing or impinging on the nerves and the blood vessels, causing issues with blood flow or nerve flow down the arm. The other thing to realize is you have bones, discs, nerves that all can be compressed or have pressure on them from arthritis. You have muscle tension that can be pressing on those nerves and blood flow. You have possible shoulder injuries that can be compressing or impinging on those nerves and blood flow. You also have anterior shoulder issues. So if you have bursitis, tendinitis, frozen shoulder, you may have an issue going on here where again, we're getting compression of the blood vessels and the nerves going all the way down your arm. You can also have issues in your elbow itself. You have 3 different bones that come together here. So you have your radius, which is this first bone here that goes to your wrist to the elbow. That bone actually helps to rotate your wrist back and forth. There's nerves that wrap around it here, and we also have blood flow that comes to this area. If you have muscles that are tight here due to overuse, overactivity, or potentially an injury, we can actually have muscles squeezing and restricting blood flow and nerve flow down to the hand. You can also have issues with alignment or even arthritis in the back of the bone here, where normally those bones are kind of shaped like an ice cream scoop. So there's like a little curve here, and then they kind of wrap around and rotate around each other. So if there's any issue with arthritis in that bone or with the nerves that go through those little curvatures there, we can have compression in between those bones, or like I said, arthritis that can press on there as well. When it comes to your hand, you actually have not only ligaments that go through here, we have a kind of a very thick band of ligaments that's called your carpal tunnel. It makes a tunnel shape around the ligaments and the nerves and the blood flow that goes into your hand. If we have a bone that's not moving properly in the wrist, or that scaphoid bone is shifted down, it can actually press against and make that tunnel smaller. So carpal tunnel may not actually be an issue with the tunnel. Sometimes it can be an issue where the bone is pressing into the tunnel and making it smaller. We can also have arthritis of that bone that does the same thing. We can have issues where that tunnel is thickened or brittle or injured, or sometimes even inflammation around that area that swells and makes the tunnel smaller too. You can have bone issues, you can have ligament issues, you can have nerve pressure or blood flow issues here. You can also have arthritis in your thumb itself. So if you think you have carpal tunnel and you're having pain over on this side of your hand or like the pinky, that's usually coming from your elbow or the outside of the wrist. Sometimes those bones can press on that nerve too. If you're having pain mostly in like these 3 fingers, that can be due to carpal tunnel. It can also be due to nerve pressure in the neck or the shoulder or even the forearm that's pressing on those as well. And if you only have issues in your thumb, you may have arthritis conditions or inflammation conditions in the thumb or degeneration of the bones that could be putting pressure on that. So when it comes to hand, wrist, arm pain, there's a lot of possibilities. So I'm going to go through some of the anatomy because I think it's really important for you to understand how it all works together and kind of what I'm talking about with visuals, not just my weird hand motions. So I'm going to pop in with those right Okay, we're coming back to my favorite book by Frank D. Netter called The Atlas of Human Anatomy. I really love this book because it's got some great pictures. But what I want to do is I want to start today talking a little bit more about kind of the lower neck, upper thoracic spine. So this is a front view. This is the sternum. So this is the front of your rib cage. And then we have the clavicle or collarbone, as people like to call it. We have these muscles in our neck that overlie some of our nerve function and blood flow down into the arm. Now, what's really interesting is when we look at when the muscles are actually there, they kind of cover everything so you can't see it. And then this is a cutaway version. So as you can tell, underneath that muscle group, there is a lot of blood flow going through. We have nerve function going through. So a lot of times if you're having symptoms of arm pain, numbness, tingling, things like that, we may actually have muscle tension in this area that could be squeezing on the nerves and the blood flow and not allowing it to travel down the arm. Now, what's really interesting is you actually have the bones of your spine here as well, and those nerves go all the way down your arm. Now, I've got a really cool picture. This is called dermatome. So this kind of gives you a view of the different nerve roots. So you have nerve roots at every single level of your spinal cord and your spinal column. So those nerves go out, and this is where they go. So when we have nerve pressure at C2, we can have pain along the whole entire head. C3 is typically at the base of our skull. C4 is mid-neck. C5 actually goes not only across the tops of the shoulders, but if we look from a front view, that C5 goes all the way down your arm to like mid-forearm. C6, which is that next bone down, so that's kind of in your lower neck area, that goes all the way down to your thumb. So sometimes when we're having thumb and wrist pain, that could actually be coming from the neck, that could be coming from the muscles in the upper neck, and it can also be coming from bone issues in the elbow, bone issues in the wrist, or even bone issues here in the thumb. We also have C7, goes to these couple fingers here. So you basically have 3 separate nerves that supply skin sensation to the hand. Now, a lot of times, if we're having symptoms of hand or arm tingling, numbness, or pain, that may be a result of bone and nerve issues coming from the neck. That can be a result of bone and nerve issues anywhere down the spine here. We can also see arthritis issues in the neck, in the shoulder, elbow, or wrist, or even in the bones of the wrist that could be causing issues too. So a lot of times when it comes down to it, if you are having pain with carpal tunnel or things like carpal tunnel, but you're not sure if you actually have carpal tunnel, it may be a good idea to get it checked out so we can see exactly what it's coming from. Is it a bone issue? Is it a nerve issue? Is it a muscle issue? Is it specifically the whole hand, or is it certain fingers? That's going to break down where we actually have nerve pressure coming from and what we can do to improve that, or possibly correct and get rid of it altogether. Here's also a view from the back side of the neck. So again, if we peel those layers of muscles back, you can see all of these nerves here, and the yellow portion is your nerve. We also have our arteries, and our veins, which are the red and the blue. So again, if you have muscle tension in the neck or upper shoulder area, it can pinch on those and cause issues down the arm as well. Here's another view looking at the arteries that go around. Basically, they go underneath that clavicle, come down the medial portion, so the inside of your shoulder on the front, kind of like where your pec would attach, and then go all the way down the arm. So if we look at the muscles, again, if we have any inflammation or pain up here, if we have a shoulder issue, sometimes that shoulder can actually rotate forward, cause muscle tension and pinching, and that can affect pain, numbness, or even tingling down the arm too. Now this view here is looking a little further down. So this is your elbow, and then down here we have our wrist. So if we look at the elbow, you actually have 2 different nerves. We have our radial nerve here, and then we have our ulnar nerve going down the back side of our elbow, kind of like your funny bone area. That's that ulnar nerve. So it kind of goes down behind in this little groove and then goes down to the rest of the hand. So this is your thumb over here. So if you've ever heard of carpal tunnel, there is actually a tunnel created by this fascia that goes around some of those tendons and the nerves that go down into the wrist. So if we have inflammation, if we have any pressure on this tunnel area, that can actually squeeze the nerves and the tendon and cause tendonitis and actually lose nerve function into the hand. And a lot of times that's what causes carpal tunnel, is the tunnel itself is narrowing. Now, the other thing too is you have bones underneath that everything's attached to. So if the bones are not moving properly, that can also cause that tunnel to be smaller. So sometimes we have a bone misalignment issue going on in the wrist that could be contributing to the carpal tunnel. Sometimes we have inflammation that's make that tunnel a lot smaller and compresses and everything. And then sometimes we actually have inflammation or damage to the cartilage that makes it tougher, more brittle, and can actually squeeze those structures as well. Now that you actually know what we're looking at, I want to kind of go through what you should do if you're having issues with shoulder, arm, hand, or wrist pain, and how we can really figure it out. So the number one thing you need to do is get it evaluated by somebody that is a musculoskeletal specialist that has the training and the tools and the time necessary, not visiting a doctor that's going to spend less than 5 minutes and not touch the joint, somebody that's actually going to examine it to determine what of those things or a combination of those things are causing our issues specifically. Typically, when I have somebody coming in that's complaining of carpal tunnel pain, we check that whole entire pathway all the way down so we can see if there's issues in the bones, the nerves, the disc, all of it. So we have real answers and we can come up with a treatment that's going to get relief and potentially even get rid of it altogether if there's not other factors like arthritis or injury that are going to predispose us to not being able to get 100% improvement. So it comes down to understanding if there's an issue in the bones or arthritis in the neck, in the shoulder, in the elbow or the wrist. That could be a big factor. Arthritis is reversible to a point. So if we have osteoarthritis or degeneration arthritis that is mild to moderate, a lot of times by moving the joints with chiropractic adjusting, exercises and stretches to get them to realign, that can actually stop the degeneration process and your body's able to heal that. Now, if you wait too long, that's number two, don't wait too long, because if you wait too long and those bones degenerate, or if they fracture because of degeneration, they will widen, and then you really have a problem because you run out of space. Also, the longer you have pressure on a nerve, you're going to get muscle atrophy and loss, you're going to get nerve damage, and those take a lot longer to heal from if you can heal from them. So you want to make sure you get it checked out sooner rather than later, and you want to make sure that you are getting answers as to what exactly is causing it or what combination of factors is causing it. Usually, if we know what's causing it, we can start taking some steps to help reduce inflammation, help reduce pain, and try to work on kind of improving biomechanics of the joint and how everything works together so you can get improvement. So when you have inflammation and pain and there's swelling and there's heat in the joint, like you can physically feel it's hot to the touch, typically you want to use ice. I know heat feels good, but that's not what you want. You want to use ice. Ice is going to calm down the muscles, cool everything down. You can also use creams like BioFreeze, things like that. You want to look for a cream that has menthol, camphor in it, or peppermint. Those help to pull and reduce inflammation out of joint spaces. So more tendinitis or itis type of conditions, ice as well as menthol, camphor, and peppermint work great for those. Now, if we have arthritis and it's just very stiff, doesn't really move very well, there's a lot of restriction that's been going on for a while, you probably have more of a chronic issue that's not necessarily hot to the touch, it's just painful when you move it or painful if it hasn't been used in a while. Typically, those conditions respond better to heat. When we add heat, we bring blood flow in so your body can heal and it loosens things up so you can get some mobility back. Some other things you can use are creams that contain arnica, capsaicin, as well as MSM works amazingly well. MSM is a joint pain reliever. It comes in a cream form, but you can also take it orally. Personally, I like the cream form because you put it where exactly you need it and it works directly on contact. And the other bonus is while you're putting it on, you give yourself a little mini massage, which feels nice and also helps to loosen things up a bit more. The other thing you want to do is you want to make sure that you are stretching those joints out as much as possible to keep them loose. When we have inflammation, usually we have to do ice and those things to calm it down before we can do any stretching. With stretching, there are a couple different exercises that I have on my website. So if you go to freedompeoria.org, I have a home exercise tab. I actually have what's called upper level 1 exercises. Those are specifically shoulder, forearm, and wrist stretches to help loosen up muscles. Now, you can modify those to your ability with motion, but if you're having pain with those, I would definitely consult again with the doctor. Find out what's going on and why you have pain so we can start taking some steps to improve it. The other thing you can also do is massage. So there's different types of massage. So there's massage that helps to kind of lymphatically drain out swelling. There's massage to soothe pain. And then there's more cross-frictional or deeper tissue massage that helps to break up scar tissue, that helps to break up any thickened tissue so you can get mobility back. So there's many different types of massage that can be helpful. And then another thing too, a lot of people like to use braces. However, in the long term, braces can actually cause muscle atrophy. They can cause the joints not to move, which will cause them to have more inflammation and tend to break down and start to get more of that degeneration process. So I'm not a big fan of braces for long-term use. Now, if you have a flare-up or you injured it, it might be a good idea to wear a brace for a week or two. Typically, I would not recommend more than 4 weeks unless you have, say, busted a bone or something like that. So there's a couple different style of braces. So a lot of people use the elastic ones that just go like around the wrist. They almost look like a bracelet that's just elastic and kind of holds and puts some tension around the wrist. There's also wrist braces that go across, kind of across the hand. There's a cutout for the thumb. So it really just goes over the hand and wrist down here and doesn't do any protection for the thumb or the fingers. So it's almost like you're wearing a fingerless glove. Those are great if we have more of a carpal tunnel issue or an overuse issue further in the forearm. Now, if you're having pain in the thumb, you actually want what's called a splica brace that actually stabilizes this joint and kind of holds it in position so it cannot break down. What that looks like is something like this. So this actually has like a metal bracing in here. So you would slip this on, you would put your thumb inside of that brace there, and then there is this little strap here that goes around and through the loop, and then it tightens around. So what this does is it puts some stability pressure here, but it basically immobilizes your thumb. So this thumb, this carpal tunnel has a bit more support. This works great for carpal tunnel as well as issues with thumb problems. I like this brace because you still have full mobility of your fingers. It's just your thumb and your wrist can't really move, which is, again, if you're having problems there, a lot of times that's what you need is some support and stability there. So to review, number one, actually figure out what's going on. Go to a specialist that's going to take the time to do a thorough exam and be able to tell you if there is neck, shoulder, forearm, wrist, or even hand issues going on that could be contributing to your symptoms of hand, arm pain, numbness, tingling, anything like that. You also want to make sure you get that done quickly. That's number two. The quicker you get answers, the quicker you can start therapy and prevent it from breaking down. I have a lot of patients that deal with hand pain for years and years and years until they finally come to me. Sometimes they have enough degeneration and enough damage by that point, I can't help them get back 100%. So make sure you get quick answers. So don't just find out, but find out quickly what's going on so that we can get it moving properly. The sooner you get in, the sooner we get answers, and the sooner we can start treatment to get it improving rather than waiting till it's at its worst before you finally seek out treatment. Number three, if you have inflammation and heat, you want to use, again, ice. You want to use menthol, camphor, or peppermint to help cool it down. If you have more of a chronic degeneration, stiffness, arthritis, heat, MSM, capsaicin, and arnica work great in creams. Number four, you want to stretch that joint out and massage it. And you also want to make sure, number five, you use braces if necessary, but not long-term forever. You want to use them short-term to get inflammation down. If you have any more questions, feel free to give my office a call or go to our website, freedompeoria.org, and request an appointment or request a visit here in the office so we can figure out what's going on for you specifically and get you answers.